going to go through quadriceps and hamstring strains. So, starting with the hamstring strain, often it will occur, they're both going to be non-traumatic, and often the hamstring strain will occur when they're sprinting, and often it can be related to when the muscle's quite fatigued and if it's quite weak, so you tend that it may occur more later in the game that they will tend to suffer a hamstring strain. Quadriceps can also be with sprinting, but can also often commonly be with kicking action as well, so it's that deceleration with the sudden traction on the quads. Often both, like I said, are not traumatic, so it will just be during that motion that they'll suddenly feel it, and when they come off, they'll often be limping, they won't be able to walk, and they'll be able to pinpoint the spot where it's hurt, so it'll just be a very focal point. So often when they come off, you'll have a look, and you'll have a look at their length of the muscle, see and compare it to the other side. We also look at whether there's any marked weakness in that particular muscle when you compare it to the other side, and see if there's a difference. And also you would then feel for the muscle and see if you can find that tender spot. And usually that'll give you a good indication that there's potential strain going on there. So I'll show you a few of the techniques. So I'll start with hamstrings. So I forget not to land to his back. So often with a hamstring, if you want to check the length of the hamstring, a good way to do it is bending the knee up, go up to 90 degrees hip flexion, and then you'll get them to try and straighten up their knee. See where it goes to, and then take a measure of that angle, and then you'll compare it to the other side, and see if there's a marked difference between the two. Then to check their strength, usually keep them in that 90-degree position of the hip, get them just to slightly lift up that other leg, and then you'll get them to lift their hips up, pushing down into your shoulder. Once again, just seeing how far is able to be lifted and whether it reproduces any particular pain. And then once again, you'll get them to do it on the other side and see if there's a marked difference between the two. Then often you get them onto their stomach. And so you want to try and find the spot where they've got that tenderness. So often with palpating for the muscle, usually I would use the base of your fingers for it. Start at the top and have a good feel, and just work your way down, just gently rolling your fingertips over, having a feel. Often if you get that marked spot where the strain is, they'll pretty much jump if they've just done it. But they'll be able to pinpoint right on the spot where that tenderness is.
So is it pain, or is it going to be like a bit of a dip in there?
If it's a really, really bad tear, you might feel a bit of dip, but often if it's just if it's about grade 1, 2, you won't really feel it. Yeah. What you might notice as well is you might see this, if you use the back of your hand, just touch, you might find it's a bit warmer and then compared to the other side. But yeah, it'll be quite hard to feel for quite a dip if it's grade 1, 2 you're looking at. For quadriceps, you think there's a strain, so get your sit up on it. Yeah, just sitting there. So checking the strength first up. So often just with them sitting there, I would put my hand in front of their shin and get them to push forward. And often see if that, see what their strength's like, and often try and get them to push forward and then compare to the other side. And like I said, often you'll find that there's weakness in that side that's affected. You can also get them up into more inner range with the cord and get them to hold it there and try to push down and notice if there's a difference there. So check the strength there, like I said, compare it to the other side. You okay? Get you on the stomach again. So, and then checking the length of the quads as well. Get the line of the stomach, they're nice and flat. I would often bend the foot up and obviously just ask them if they're feeling any pain or any discomfort when you're bringing it up, and also feel for any kind of tension as well. And then once again, you find out where that point is, compare it to the other side, and see if there's a marked difference between the two. Get you onto your back. So when palpating for the quads, it's pretty much a similar thing, but I'd often put a rolled towel underneath. So I often get a rolled up towel, just put it on there, just to put a bit of flexion there. And once again, base of your fingers, start at the top, just have a feel. And then slowly just rolling back and forth and having a feel and finding that point where they get that real marked tenderness. Any questions with that so far?
Adrian, can you show us rec fem? Because I think that's probably this. You've got 4 quad muscles. 3 are your sort of single joint muscles where it's only involved in the knee. So those tests that Adrian just showed will pick any of those up, vascular strains. Probably the more common one that we see is the guy that's sprinting and does a rec fem, which is actually a long muscle that actually goes over the hip as well. And they tend to be really central. It's a strap-like muscle that runs straight down the front and it's quite superficial. So how have you tested strength on your rec fem?
Yeah, it's a good way to test it as well. It's just you taking that out, getting him to raise the leg up. So once again, it is across both the joints, the knee and the hip. So get them lifting it up. Once again, just seeing how that goes. If they're doing that okay, just putting a slight bit of pressure just on the shin and seeing how they can handle that. Often power painting for the rec fem. So as Tim was saying, it usually comes down towards the centre. So going towards the centre, just feeling for it. You would often feel that muscle, you can kind of roll over it. Once again, you won't feel so much the strain, but you can feel for that muscle as you roll over it, and they'll, you know, if it's initially done, they'll jump with it, or otherwise they'll be able to say, yeah, that's the spot of pain is. So initially, as soon as they've done it, you just want to go to your icer, you want them to rest it, you want to get them to ice it. They can ice it for 20 minutes on every hour. You want to get a good compression on it as well, and get them to elevate it, and then refer them onto physio just to have further assessment of it and to begin rehab as well. It'll also be a good idea, you can start off on that first day, you wouldn't give them any strengthening as such to do, any strengthening exercise, but you can get them to do some gentle range and motion exercises. It's a good idea to start with. So one, for example, is getting right on their back, and they can just gently try and just bend their knee and just go to what's comfortable. So it's all within what's the comfort limits only, and then straightening back out. Good. Just getting them to do that, just to keep some range, just keep those muscles active. Depending on how severe it is, you might even, they're fine to use some crutches if they need be initially. That would be a good place to start. Often you don't want to give them anti-inflammatories for the first 48 hours while it's still, during that phase where still there's bleeding on and so forth. Just avoid the anti-inflammatories. After about 48 hours, then they can start to take some to, as long as it's, advised by, pharmacists and so forth. But that should be fine. And
probably 3 to 7 days, and then I'll stop again at 7 days. So again, that's something that obviously we might deal with, or the docs might deal with. But if you've got guys that have had muscle strains and are self-medicating, probably don't let them take anti-inflammatories past 7 days, because there is some evidence to say that it'll weaken the new tissue that's formed, and they'll end up redoing it potentially at a higher rate. So just a little tip again, if your coach says to you, 2 weeks after a hamstring strain, I'm still taking some Voltaren or whatever, because you can go and buy obviously Nurofen and Voltaren over the chemist, and a lot of that fucks self-medicate these days, so especially footballers. It's probably worthwhile just saying, are you taking anything down the track, and just say that it's probably not advisable to keep taking it a week later. Is there anything I'd say about any coach? You don't need to know, but just know enough to say it's probably not a great idea to them.
So often we'll start doing some strengthening work for them, usually when they're starting to walk pretty comfortably without a limp, and start to get them to do some strengthening. And strengthening exercises will just be dependent on their tolerance at the stage, whether depending on how aggressive or how much, what kind of exercise we give them, just depends on how much they can really handle, how much they can tolerate to begin with. So pretty much, if you want to tape it up, you can do similar taping to what Dave was saying with the calf, where you put the elastic tape over first, and then you can get like a, rolled up tape the size of a finger, put over that spot, and tape that spot up just to take a bit of load off of that spot where they got the tear. But often you wouldn't really want to get them out there anyway until they're fully rehabbed, their strength is equal to the other side, good length in that muscle as well, and they've gone through some training and good week's worth of full training, and they're feeling pretty comfortable, and their physio is happy with that they've addressed all the factors, and that they're not at risk of re-injuring themselves.
I was just going to say before that taping for muscle tears is, I don't use that in a grand final or a go-go.
Yes, sir.
Yeah.
So I'll just be really honest with you, I wouldn't tape a muscle otherwise. I think it can be slightly effective to keep it going for half an hour maybe if you need to, getting through the last quarter of a game. But the reality is, it's probably doing more damage to the muscle tissue. So, obviously if it's a there's a grand final, our blokes still want to go and give it a go, and that's fine, and I think it's something you can use for that, but I wouldn't be using it round 3 and expecting them to do right because you taped it up for the next week. Probably putting them out for longer than they should be otherwise. So that taping technique, I think it's useful, but probably in very limited circumstances.
You definitely want to make sure they've gone through their rehab and their strength's there, good range before you really want to get them back out on the field.
Actually, if I can say, I did use that technique back in 2012, and it was a hamstring, but I used a straw out of the drink bottle.
Okay.
And I used that because that was rigid, and that worked. You got through half a game, that's all we needed. And we won. That was the grand final. I don't use it as to say the grand final. But just one more, I didn't want to interrupt you earlier. When you say about the hamstring, if you get a reoccurrence of the hamstring, is it, I don't think it's a myth, that if the quads are weaker, that can contribute to hamstring?
Yeah, definitely one contributing factor to hamstrings is the ratio of strength amongst the quads and the hamstring, and that definitely does play an effect into it. And there is evidence as well, even having tight quads, without going into too much detail with it, tight quads can cause the pelvis to, you can put a bit of an anterior tilt in your pelvis, which then puts more of a stretch on the hamstring, and so it does put a more risk of tear. So there's definitely those factors. So you definitely, we tend to look at, the quads as well, the length and the strength and so forth and the ratio, because that does tend to play a role into it. Yeah.
So if someone does have a tendency, get them to try and feel that. What up? A little bit more.
Build it up and stretch it.
So,
Yeah, stretch, but it's also worthwhile checking the strength. But like I said, there's a ratio that you want to address, and usually we would be able to use it with a dyno. So we've got the dyno where we can actually measure the strength on quads and hamstrings, and right there.
Just while you were talking about all that, so
yep.
especially guys who've had reoccurrences, getting actually some objective measures of what their strength's like is probably pretty important. So we can actually do that reasonably well in the clinic now, or a lot better than we used to be able to. We're using a dyno, so basically just plug it in and do max strength testing in the clinic in a few different positions, so we can actually look at quads hamstring ratios and those kind of things that maybe be contributing. There's heaps of things that also can contribute to recurrence, but that could be one of the definite things. So getting that ratio.
Bit of effleurage, so just try a bit on there. Just kind of starting off gently, just with your hands, just with the webbing between your thumbs, just working your way down. If they're going well, you can even get to your knuckles a little bit there and just dig in a little bit more into the muscle, really get the spots that you're after. And once again, you can, if you really, there's quite a bit up hamstrings and you want to get in there a little bit more deeper, you can even use your elbow to get the elbow in and really just push upwards on the muscle there. Those are both better techniques to do, just to really get into that muscle and just really try and free it up. And like I said, you can do the same thing for the quads.